Hello and welcome everyone to Prepare to be a Proxy. Are you ready? I'm Githoe Mina, Director of Digital Programs here at Compassion and Choices, the nation's oldest and largest nonprofit dedicated to improving care, expanding options, and empowering everyone to chart their end-of-life journey. Before I introduce today's speakers, there are a few housekeeping items I would like to share before we get started. First, if you need live captioning in either English or Spanish, please enable it at the bottom of your screen by double-clicking the Cs and following the prompts. If you have any questions, please put them in the Q&A box located at the bottom of your screen. There is no need to raise your hands. We will take questions directly from the Q&A function, and we will get to as many of the questions as time allows. And lastly, as you may have heard, this webinar is being recorded, and we will send it out along with the slides post-webinar, so you can view it again and share it with your community. Now, it is my pleasure to introduce our wonderful speakers. We have our Clinical Education Manager, Meagan Williams, and our LGBTQ+ Engagement Director, Osha Towers. Now, without further ado, I would love them to also introduce themselves and talk through what we're going to talk about today.
I'll go first. My name is Meagan Williams. I'm our clinical engagement manager. Thrilled to be here. Thanks to those of you who are here, perhaps only for this part. Thanks to those of you who are coming back for part two. Thrilled to be here. Thrilled to be here with Osha. I'm going to pass it on to them.
Beautiful. And thank you, Meagan, and thank you, Githoe, for the introduction and going over all the sweet housekeeping things. We can go on the next slide too, so you can see not only our lovely faces here, but some additional cute photos of us too. But my name is Osha Towers. My pronouns are they, them. And as Githoe said, I'm the LGBTQ engagement director. So working across the country with individuals, families, community members, and medical professionals on really making sure that all of our folks are able to feel prepared, feel seen, and feel supported in their healthcare and end-of-life experiences. This is the second session of a series that both of us and many at our organization have been long excited for, because so often we talk about the importance of having a healthcare proxy and adding this addition when we're thinking about advanced care planning. But often I know it can feel like, okay, I know that's a thing I should do. I want to do it. What is the next step? How do I actually move forward on this? So last time we talked through selecting an individual and taking that next step with really requesting and seeing if this person is the right choice for you. And this time it's going to be more of a focus on the proxy. What does it mean now that you have said yes to taking on this role? Is this still a role that you feel comfortable moving forward through, even after we have more of this conversation? And more importantly, how can you feel the best prepared to be an advocate and support for this individual? So we'll move on to the next slide and go over what the agenda for today is. So today is really going to be focused through first starting off with some of the reminders from what we discussed last time, and then going over not only supporting your proxy as an individual seeking out this role, but also, again, as I said, being prepared to be a proxy, and then navigating the decisions that come up from there. And then we'll end it with some additional resources. This is a national webinar and a larger conversation that can always go so much deeper into so many specifics. So we know that we're not going to cover absolutely everything today, but this is a starting point and a guide so we can make sure that you all feel prepared to take that next step. And those resources that we'll have at the end will be a continuation so you can actually feel more prepared. So on the next slide, our objectives for today, what we want to make sure that you walk away with. So understanding the roles and responsibilities of being an effective proxy, understanding the importance of knowing the values and priorities of the person that you are representing, because we're representing them, not ourselves, right? Understanding the roles of the care team members, identifying any sort of mixed messaging that might naturally come up when associating yourselves with different folks across a clinical team, and knowing when and how you will have to be an advocate in each of those settings. And then learning the 10 key questions to determine if a test or a treatment is actually the appropriate next move for the individual that you're advocating for before deciding on consenting to proceed moving forward. And lastly, exploring navigating family and loved ones dynamics in care decisions while also making sure to care for yourself. I know that this is a big one that often gets overlooked because, of course, we want to prioritize putting so much thoughtfulness and care into whoever this individual is that is seeking out the role of a healthcare proxy. But we also recognize that you are a human being in this too, and should feel able to be supported and take that next step if that's not necessarily putting it on the onus of the individual that's seeking out a proxy, but what sort of self-care, what sort of outside experiences do you need to feel secure in having this role and navigating some of those difficult conversations that naturally come up, whether it's in a medical setting with providers or in family dynamics. So on the next slide, I'm just going to do a quick overview of some of the things that came up last time to make sure that we're all on the same page. The last presentation, as well as this one, is recorded. So you will have the opportunity to not only review this, but if you need to go back or if you missed the last one, know that there's still the option to see all the things that we talked about. But this is just some of those key points that I think will be helpful to make sure we're all on the same page with moving forward in this conversation. And really quick, this just reminded me too that I want to highlight that you do have the option to send in questions and comments, whether in the chat or in the questions and answers section. And as we go through the presentation, sometimes it naturally just gets answered. But if we aren't covering something specific in this presentation during the earlier stages of it, then we're happy to make some more time at the end to go over questions given how much time we have left. And if we aren't able to cover certain things, then know that there will be a follow-up email answering and identifying some of the points that came up, as well as just knowing that my favorite part about having questions and conversations with folks at webinars is knowing that this might just be the question that builds off another webinar for us. So please feel free to throw as many things in there as possible. So the first part is really just the quick overview of what on earth even is a healthcare proxy. What are we talking about? So being specific to thinking about an individual that has been chosen to be an advocate for someone else in the situation where someone isn't able to speak for themselves. So really thinking about having a voice for someone when they can't have it. And the importance of that is, again, why we want to have discussions about what actually are your needs, what are your values in overall healthcare experiences, so that healthcare proxy is able to show up best for you. And as an advocate, thinking that this individual is not someone that is passively letting whatever happen, whatever the doctor says is needed, but really being able to stand up and stand firm in speaking out what the values and desires that you all have discussed previously are. One of the other things that we discussed last time is language and requirements across states. As I said, this is a national webinar, so we're not going to go over necessarily all the specifics, looking at Michigan versus Texas or California versus Florida, but we do have some resources at the end so you can dive deeper into a state-specific advanced directive and some of those requirements, because we do know that there are differences. Like, let's say having an individual in some states, they require someone to be 18 or older versus 19 or older. Some states have more standardized forms that you're supposed to use versus ones that have more flexibility in creating your own documentation. Some states also might have differences around using something like a POST or a MOLST, and that is talking about a physician life-sustaining document or a medical life-sustaining document. So being able to dig a little bit deeper into what are my state requirements? Do things need to be notarized in a specific type of way? Or is that not a requirement for the area that I'm in? So again, we do have resources at the end that can help you dig a little bit deeper for that. The next question is, am I allowed to say no or change my mind? And Meagan did a beautiful job last time discussing her own experience with her family and with showing up as a healthcare proxy for numerous different folks, and knowing that sometimes we can't be everything for everyone, right? Or sometimes you are in a position to continue to show up as this one specific role, but there's other ways to offer care and support for individuals in your lives. So it is okay to have someone come to you and ask to be a healthcare proxy, and you have the knowledge that that's not a position that you can take on right now, or later realizing, given life changes as it happens, you're no longer able to take on that role. To me, it feels like an important gift to be able to tell someone, hey, I love you, I care about you, and this isn't something that I'm able to do right now, versus continuing on taking this role and not being able to show up in your fullest for an individual, right? And lastly, being values focused over knowing absolutely every single answer. I know that for many of us, healthcare experiences can be intimidating. And I think just as human beings, it's nice to feel like, well, if I can just get all of the answers and know every single scenario and know every single situation where a doctor is going to be involved and whatnot, then I can feel solid. The reality is that's just not how things work, right? So sometimes it's important to take a step back and really just remember that your role is to make sure that, yes, you are having those conversations about specific scenarios, and we'll go through that later on in this presentation. And yes, you are discussing more of those specifics around if it gets to a point where maybe we need to be put on life support or any other forms of care. Is that something that you're interested in? Or do you want to be resuscitated? Those sorts of specifics, that's really helpful to know. But at the end of the day, the main focus here too is being certain that you have an overall idea of what are the values that this individual carries. And then from there, with situations that will naturally come up that you might not necessarily have had a detailed, specific conversation on, you can feel confident in yourself to know that moving forward, you're making a choice that's reflecting those values. So on the next slide, now we're going to get into a poll. So I want to hear from you all on starting through, what is your role today? And when I say that, I mean, are you someone that's coming in wanting a healthcare proxy? Are you someone that has been selected or is thinking about being a healthcare proxy for someone else? Or are you just here for a good time? You want all the information, you want to learn all the things. You might be fluidly interested in, what does it mean for me to be a healthcare proxy at different points in my life, or maybe requesting a healthcare proxy at other points in my life. All are completely good answers and make perfect sense, but just want to see where folks are coming from today. Ooh. Well, sometimes you take a sip of tea and it just is perfect. Okay, so that looks good. I know that we're at about 84%. So right now it looks like a lot of folks that are pretty split. We have folks that are coming in as an individual seeking out a healthcare proxy and folks that are showing up as a proxy. So thank you for sharing that. And I know that last time we asked folks to even come join the conversation, bring in your proxy. Let's talk about it together. So if that reflects any of you all, I'm happy to have each of you here. And the reason that we're even asking this question is to really get a better gauge on, as we move forward, making sure that we're using the language that feels the most supportive of everybody here. Is like, I'm just looking for a proxy. I want to know how to better support them. What are the tools for them? Then we could change some of the ways that we're phrasing things today. But since it's a really good even split, I think that moving forward, this is going to be helpful information for everybody here. But a lot of what we're saying is really going towards the individual that is showing up as a proxy. As someone that is not a proxy and has selected someone to be there for them, these conversations are still important for you, because it's still important to be able to offer those tools and have those discussions with your proxy and figure out the best ways to support them too, to make sure that they can best support you. So on the next slide, we're going to start with discussing preparing your proxy. So again, going back to, as an individual seeking out someone, what does it mean to make sure that they're in the best space to be a support for you? The first thing is the recognition of vulnerability being shared. When choosing someone to actually hear all of your medical history, that's important for this, know your wishes, know where your care needs are at. I get that that requires a certain level of vulnerability and openness. And as a society, that can be intimidating. We don't necessarily have a standard for sharing a lot of our medical experiences with folks. I know that more often in disability activism circles and spaces, that can be a more common practice where people are more openly discussing what their needs are, where they're at right now in their health. But that doesn't necessarily mean that that's everyone's experience. So having the knowledge that, yes, I get it. This is not easy. It makes sense to want to be more protective of your health experiences or have more nervousness with opening up about it with folks. But in this position, it is essential to make sure that the person that you're selecting to be your healthcare proxy is aware of what's going on in your care needs. And I say that because I know that often what folks will do is feel like, well, it's nobody else's business. You know, I've selected this person and they can just show up and take over when I need them and just, you know, do your thing, right? And I get it. And again, I think that can be really protective. But the reality is that the importance and benefit of having these conversations and making sure that your proxy is more fully locked in and aware of what's going on within your care is that it can be a smoother transition for them to actually show up when you're not able to offer deeper understanding of what's coming up. So the reason that I say that is when thinking that we're in a rush moment and somebody needs to make a quick decision, there's not a lot of time to go over, well, this is everything else that we've already tried and that they've said before about their healthcare needs. And now from reading through this booklet or whatever, make a decision, you know? So being able to have, again, just those proactive conversations and sharing that information can be a really helpful tool to make sure that folks aren't left in the dark and then having to quickly choose the best course of action. So the next point here is who should know your proxy and be connected to them. This also is a continuation of making sure that we're being open with folks. I think the short answer is everybody, right? The very real specific answer is that people like your primary care physician, folks that are offering in-home care, specialists, folks that are part of your larger care team should know who this individual is, and that can be a really helpful tool for them. So when they show up, they already know, yes, this is the person that I'm listening to. This is the person that is aware of what's going on with the healthcare needs of this individual, and we can have a trusting conversation. I also think that it's really important to make sure that they're connected in a way where you can send introduction emails. You can bring them to doctor's appointment. And even showing up at a medical setting can actually be a really helpful tool for them too, because sometimes there's things that we miss sharing with other folks when we're trying to repeat back everything that came up in, let's say, a doctor's appointment. So having this person there can make sure that they're not only being introduced to the folks that are a part of your care team, but it also means that they're able to have a real life, in the moment sense of what your needs are. And again, feel more comfortable with advocating for you in the event that they need to. The other part of who should know your proxy is making sure that other folks that are part of your care team that aren't necessarily in a medical setting are aware of who you've chosen to be your proxy. This is all advice for what can be helpful. Of course, I'm not telling you this is how you need to live your life and this is what you do. But the reason that I say that is because it can be helpful for folks, if you're able to share this, to know who you've chosen. So there isn't this discrepancy and moment of haste and being rushed through, okay, well, what should we do? Who's making the call? All of this, because they know who to look to. And this can also ideally help with any sort of frustration or animosity towards anyone else that thinks they should be that person making those decisions, because you've already named that's cool that you think so, and you can be a support potentially in other ways if you feel that that's supportive. But at the end of the day, this is a person that's making those calls. And the last part is making things legit. This is regularly one of the main things that come up when talking about healthcare proxy. Is it even legit? Especially if this isn't someone that I'm married to, is there any weight behind this person being my proxy? And we're here to say yes, this is a legitimate role. And some of the ways that we can go about preparing to make sure that this is taken seriously is making sure that you're completing the proper forms and having this person involved in your advance directive, making sure that you're telling, again, your doctors and medical team about them, and making sure that if you live in a state where something needs to be witnessed or notarized or anything like that, they're actually moving forward with having that paperwork filled out and the proper channels. Again, we have that resource at the end. So this isn't something that's left incomplete and therefore not taken as seriously. So that is a full overview with starting on the end of just preparing your proxy. And now we're going to move into, as a proxy, what does it mean fully being able to be that support person, and what tools do you need to be able to show up for an individual?
Thank you so much, Osha. Thank you for setting us up. Thank you again, all of you, for being here. And to those of you who will follow along with me while I use a little bit of proxy-focused language. Next slide, please. So your role as a proxy, on top of, again, I'm also going to probably reiterate some things that Osha shared and that we shared in part one. Consider those bolded, underlined phrases that we think are really important. Beyond the role that we kind of ground ourselves in around supporting someone when they're unable to speak for themselves, I want to again reiterate and highlight that this role includes, to varying degrees, supporting someone when they are able to make decisions. So again, just reiterating that early connection, exploring options alongside someone, helping with appointments, serving as an advocate when appropriate, is a really powerful way to help you get connected and grounded into the role and help to start making the connections that are needed to really serve this person. As a proxy, you receive, the same information and same conversations a person would have about their own health care. So that includes discussing treatment options, communicating directly with the healthcare team, consenting to treatments or procedures. That also means you're in a position to request a consult or make decisions around healthcare providers, call for a care team meeting. These are all things that you as a proxy can feel empowered to do on behalf of someone, and you can start talking early on to the person you're supporting about what they would like, what their wishes and needs and desires are, what kind of advocacy they're looking for. And you might run into people who don't understand your role completely. Like Osha alluded to, there's confusion and uncertainty about the legitimacy. And so part of your role is also sometimes going to be repeating yourself, especially as you're getting to know some of these folks. Saying things like, I am OSHA's designated healthcare proxy. My role is to make decisions on their behalf. And based on the conversations and planning we've done, I'm dedicated to ensuring that they get that care. Those having things like that you're ready to say to describe your role when you meet and interact with some of these team members is really critical. In part one of the series, like Osha mentioned, we stated how important it is for a proxy to be someone who can really advocate for you. So it's also important to know as a proxy, we're likely chosen for this ability. It is one of the most challenging parts, but advocating consistently makes a difference for everyone, and it sets an immediate expectation that you are the person to go to who's going to ask questions, make decisions, and lead confidently, knowing the person that you're supporting well. I want to just kind of reiterate again something that Osha said, which is that um, advocating for your person will feel more intense if they are unable to make their own decisions due to an unexpected event, an accident, a sudden crisis, rather than a terminal illness or medical concern that you've discussed for a long time. So emotionally, those things will feel different, and deadline-wise, those things will feel different. So when we talk about some of the important questions, when we get to the next slide, those are things again that we want you to think about asking early and often, so that when unexpected and if unexpected situations come up, you have what you need to make decisions quickly. And in terms of gathering and organizing information, OSHA already outlined what some of that paperwork might be, but making sure that you as the proxy have a copy of someone's advance directive, copies of things like their POLST or MOLST form, like OSHA mentioned, that are things that they would be doing with their physician, having copies of things, notes, and other paperwork that might be relevant, having that on hand and being prepared to have additional copies of that as needed is kind of one of the big things paperwork wise and in terms of organizing information that we encourage proxies to do. But also having information on things like medications, provider name and contact information, current health issues, things like that will also benefit you in the changes, in the cases of sudden changes or situations, and will also help you fill in some gaps. Um, of course, making sure, kind of similar, connecting to OSHA's topic, it's not just wonderful to make sure that you're doing introductions, but also making sure that loved ones or who are nearby or part of the care team also, if needed, have copies of those documents. And speaking of the care team, it's important to identify what that means. We kind of say care team in a fairly expansive way here. So I will say I'm talking a little bit beyond just like a healthcare system team. But it's really important to identify the folks who are already providing care to your person. OSHA mentioned some ways to engage early on. And there are potentially a lot of folks involved depending on your person's needs and situation. So you could be meeting a primary care doctor and their staff, but over time you end up meeting other providers. Perhaps other new things come up or develop, and you have the inclusion of social workers or palliative care specialists, other providers of all specialty providers of all kinds. Then potentially hospice teams and chaplains and a hospital patient representative or an end-of-life doula. So it could be that this team expands over time or changes, or, and of course, you might have somebody that retires or moves hospitals, and now you have a new provider who comes in. There also might be people like transportation services that your person works with regularly to help them get to and from appointments, or even community members like church friends who help pick up medications or deliver food. Those are great people to also connect with and make sure that they have your information, and you have theirs, but really taking a holistic look at who cares about the person you're caring for, and how can you engage with them and make sure that they know who you are, you know who they are, and you've already established rapport before there's anything heart-wrenching that you're navigating together. So again, working with the person that you're supporting to identify who those folks are and find out how to best introduce yourself. Like OSHA said, you might have somebody who says, "Oh, my doctor, like, doesn't reply to emails, but always calls," or whatever it may be, finding out the best ways to engage and interact with someone. And I want to also reiterate that, providers are often experts they're experts in their field, they're highly trained in their field, but you are the expert on the person that you are supporting because they are the experts on themselves. And they have imparted that onto you. So keeping that close at hand when you meet with team members can be really helpful, just to remember that that is your role. Um, and again, part of gathering and organizing this information is making sure that all of those people we're talking about have that same information. And I also want to point out that, unfortunately, like Osha said, we can plan as much as we want, but things don't always go to plan. And so it's important to remember that the person that you're supporting might end up experiencing an unexpected event and find themselves at a hospital system who doesn't have your information or where they've never been. And having all of those documents on hand, making sure that next of kin knows who you are if you're not next of kin as a proxy, that is critical to helping your person get support right away. And the professionals I just mentioned and beyond all the folks, but truly the healthcare professionals I just mentioned, they come from different fields and specialties. And so they each kind of have their own forms of communication. And so that might mean that you have some mixed messages coming through. And I'm sure we've all experienced this to some degree, perhaps in smaller ways. But the word treatable is a really great example that I know we've highlighted before. In 2018, there was a issue in the Journal of Critical Care Medicine that highlighted that patients and doctors hear the word treatable very differently. Research showed that doctors use the word treatable kind of in place of incurable, meaning that there was treatment that could be applied, but that didn't mean to the doctors in this study that the treatment would succeed or that the disease would go away. It also didn't mean that the treatment was going to prolong life. On the other hand, that same article highlighted that patients felt the word treatable was a positive term, that it could mean that the disease could be cured or potentially contained, and there was an assumption that it would not diminish quality of life. And that research showed even more deeply that even when there's maybe really what some would consider dire news or a really, big piece of new information that might be a prognosis you weren't hoping for. Even in contrast to that, if the word treatable is present, people are less likely to really take that news in. Um, Other examples of this are things like, we'll do everything we can, which might imply consent to treatment that you or your person may not want. And thinking about these mixed messages is not shocking, right? Healthcare teams are trained to keep us alive. That is for most of them, that is their end goal. And our brains want to protect us. And so with those two things combined, we end up with mixed messages. And studies suggest, though, that patients want to hear honesty. They want to hear the truth. They don't want a vague overview. And of course, this absolutely changes based on cultural norms, other, faith considerations and other things. But by and large, studies show that most people want to hear honesty and truth about what is coming. And that means that you as a proxy need to help wade through that language to get to the truth. And you might even be called to do that while you're exploring options with the person you support while they're making their own decisions. And we'll go through again some more questions in the next slide that can kind of help you with some of that. But making sure that you're asking deeper questions, asking for clarity to get through some of that miscommunication. That's just something that proxies are always most effective when they're able to navigate that. And we also want to make sure proxies are aware that, again, this is something you likely have experienced in your personal life. A lot of people have, that you might experience communication differences due to specialty or region or hospital system. An ER doctor's prognosis or communication style bedside manner might be different than that of an oncologist, who might be different than that of a neurologist, who might be different than a family care practitioner. And a doctor who has a really deep, close relationship with your person might also communicate differently than someone who, again, is seeing them in crisis or is seeing them in a system they've never been in before and has no background. So again, you are the expert on your person and you get to bring that with you into these conversations. And the last point here excuse me, on this slide is to staying engaged. This, as I'm sure you've gathered, this is not a one-time agreement. It requires a nourishing of a relationship between you and your person, and potentially their loved ones, if that's who they're surrounded by. And this is not a role that you should only be stepping into or experiencing when the person that you're supporting is unable to speak for themselves. Preparation and discussions and support should be happening from the second that you say yes. And making sure that you have new and ongoing discussions and revisions when there's updates, you have new information, there's a new diagnosis, there's a change in situation. Um, there's, often we recommend that people review their advanced directives every single year on their birthday or something. There's ways that we can have it be built in to part of your ongoing relationship with them. And so again, as long as they are able to make decisions, utilize the time you have with them to understand their values, their wishes, and the choices that they would make, because that is the time you will want more of when you are faced with having to make some of these decisions. Next slide, please, Githoe. Thank you. So these 10 questions come from our a book called Finish Strong, Putting Your Priorities First at Life's End by our President Emerita, Barbara Coombs Lee, who is a nurse practitioner, attorney, trailblazing patient advocate. And these are 10 questions that she's really highlighted as things that we can be considering for ourselves as well. So you can absolutely look at this as questions you can ask for yourself. This is not just proxy questions. And they're great to go over with the person that you are supporting while they are present and in discussion with you. You can say, these are the questions I might refer to when I'm making decisions. Do any of these give you an immediate reaction? How would you want me to evaluate things based on these questions? And documenting those responses can be really helpful. Again, because like Osha pointed out, we can try to gather as much information and be perfectly prepared for everything. And that's just not ever going to work out exactly 100% of the time. And so having as much information and background and insight as possible will be helpful. This is, conversations that you're having with your person you're supporting. Are great to record if possible. So you can, take out your phone and check out the native voice note app, or recording on a video somewhere. These are great opportunities for you to be able to capture their thoughts long term and refer back to them when you need. So let's look at these questions together. We'll just go over them quickly, and we'll make sure that in the follow-up email that we also send these so that you can access them again. But what is the goal of this treatment? What proportion of patients who receive this treatment achieve that goal? So in other words, how often is this working for other people in similar circumstances? You can even ask that question kind of in that way. If the goal of this is to prolong life, what is the expected increase in expectancy in months or years? What are the risks or side effects of this test or treatment, and how often do they occur? How will this treatment affect my person's quality of life? What is the expected frequency, duration, and recovery time for treatment? Is there a chance that this test or treatment will make their condition worse? What are other test or treatment options? And kind of again, probing, are there additional options beyond these that have been mentioned? As we've, for various reasons, you might have providers who don't give you all of that information until you prod or ask a little bit differently. What will likely happen if I decline this test or treatment? When is that likely to occur? And what is the life expectancy without treatment? So again, if you're handling or being met with a situation that you haven't covered with your person yet, these are great questions to get answers to from the provider, and then use the information you have about your person to navigate these questions. And at the end, we will talk about our end-of-life decisions guide, which we already sent out, and we have some other resources. And again, those resources similarly are kind of like a little library. Those and videos of your conversations or recordings you might take, paperwork, those are all like a little library on this person. And it might not have all the answers, but it should have the hints and the insight that you need to make a good decision. So the End of Life Decisions Guide asks you a lot of different questions to explore different thoughts around a lot of these as well, as do some of our other resources. And so again, the idea is to help you ask the questions and get the insight that you need to make good decisions. Next slide, please, Githelli. Thank you. So managing dynamics and taking care of yourself. As Osha said, that's kind of a huge element there at the end. So we will make sure to have time for that. So managing conversations. As a proxy, you have the ability and the capacity within your role to talk to everyone involved in your person's care. And it is a huge responsibility, and it often requires calm, thoughtful discussions, which can be even harder to have in stressful environments, which is again why we reiterate preparing for these ahead of time, when possible, so that when you're up against a challenging situation, you can pull from your library to get the answers you need. And again, we discussed that picking a proxy who can be assertive and consistent in their upholding of your wishes is really important, in our first session, and we've talked about it again today. And we've also discussed that that person being a close relative might not always be the best choice. As Osha said, I'm not able anymore to be the healthcare proxy for my parents, but another loved one is. And in those cases, in cases like that, proxies might be missing some context for family or community dynamics that can be really helpful for the proxy to know. So for example, I might tell my proxy about a really organized aunt that I have who can be relied on for logistical support and is also really good at getting the family united. That is the kind of person that would be great to talk to your proxy about, because that's somebody that the proxy might need to connect with and might need their help at some point. Or perhaps I have a close friend who has cared for me, and I know that they have the best of intentions and they're a great person, but I also know that chances are, if I'm unable to speak for myself, they're going to be really emotional and maybe come in and try to take over or make choices. That is someone else that I should talk to my proxy about. So my proxy's ready to have conversations with that person and probably has them before I'm in need of their support directly, so that they can have a rapport and a relationship that makes that easier to navigate. So again, as a proxy, if your person does not divulge some of these family dynamics in the information that they share with you, you can ask straight up, are there any dynamics in your family, in your care community that might be helpful for me to know while I support you? And you can give examples. Do you have a loved one who's really organized and can help with logistics? Do you have a loved one who has really big opinions and might try to come in and boss me around? You can have, and I certainly have loved ones who are that way, and I want to make sure my proxy knows so that they can be tended to like with care, and that neither of them are put in an uncomfortable situation. And there are multiple scenarios, again, as a proxy that you might navigate, and thinking through some of them ahead of time can be helpful. One of those, it's fairly common, that's a scenario is, let's say you're a proxy for someone who has a lot of loved ones around. Perhaps it's not, biological, but they have a big community of people who love and care for them. And that also leads to a lot of big mixed feelings, fear of loss, just big emotions that are happening when someone is potentially not able to speak for themselves. So in these situations where somebody has a lot of people around who love them and they have a lot of big opinions and you're the proxy, this is again why we encourage you to be introduced to your person's community of loved ones already, if you're not already kind of a full-fledged member naturally. Or if you had to a chance to connect with them in some way. Perhaps you're one of their dear friends, but you haven't really met their family, or you haven't met their, another really important community of theirs, their faith community, perhaps, that is also really important. And so, in the cases where you've got relationships with these folks, using that relationship to ground some of these big emotions and overwhelm can really help remind folks of the wishes that their loved one has shared, which again, when you have shared your proxy to your loved ones and said, I have told this person they can speak for me and we've done this paperwork together, you are kind of you're allowing your family and loved ones to trust them. And so as a proxy, really leaning into that is important, as is recognizing that those feelings that they're having is valid and that you as a proxy will have to navigate some big feelings from a lot of people. So doing your best to remind folks calmly of your role, that you're there to make their loved ones' wishes known so they can spend time with them and be with them and not have to think about those logistics, can be a helpful way to kind of get to the core, which is often that people are just feeling really overwhelmed and scared and sad and want somebody to talk to. So reminding them that you know what you're doing, your loved one documented their wishes, and it is my honor to make sure that they are followed to the best of our ability. I need you a part of this. That can help really reinforce the purpose and get people focused on spending time with their loved one, which is part of the benefit of having a proxy, so that your other family and loved ones don't have to be thinking about some of this stuff. Again, in some instances, it's again helpful to have those copies of advanced directives or the completed end of life decisions guide to show a loved one, to remind them and ground them in, this is what we went over, this is what they decided, we're following through with that, can just reassure someone that the right thing is happening. And again, in many instances, though, this is a really emotional time and people simply need space to be heard. And so if that's feeling outside of your capacity, calling, gathering a family meeting, calling in perhaps that great unifying aunt that your person told you about, or somebody from their church that's wonderful, or somebody in their run club that's like really great at organizing everyone. Asking people to come together and talk and share can often be really helpful. Of course, in a crisis situation, it's challenging to make something like that happen time-wise, but if available, the support of a social worker, a death doula, a faith leader, another support person can also be really helpful to do this, so that you're helping organize some space for everyone to share their feelings, but you aren't responsible for navigating it. Because remember, just because you are the proxy does not mean that you're doing this alone. Another situation kind of that I mentioned before is a healthcare provider giving mixed messages or not being clear enough or direct enough with you. So this is, again, as we touched on, this is going to be very likely. This happens in a lot of scenarios. And so proxy should, of course, be taking notes wherever, whenever you can. But sometimes in the midst of doing that, we need more information. And so we just want to reiterate that it is normal to need more information and clarification from healthcare teams. It is not a sign that you are not aware. Like Osha said, we cannot know everything. These people are experts and they use acronyms and all sorts of phrasing that we probably don't use in our everyday life, or that we might not. And so it is totally normal and okay to ask for clarity, and you should feel empowered to do that. It's also an opportunity to connect with the provider in a different way. So as a proxy, you can ask them to repeat or clarify at any time. It can be as simple as, I would like to talk to you a little bit more about Osha's wishes, or you mentioned that this is treatable. Can you tell me more about the outcomes of the treatment? Or just pulling one of the questions from the last slide and using that as a prompt to have a deeper conversation. As simple as, can I have some more information about the procedure that you shared? I have some questions I would like to ask about the diagnosis. When is a good time to meet? So these are good ways to kind of ask for time that you should be allowed to have, and that you should not feel like you can't ask for. So being direct and asking for clarity is something you absolutely should be able to do. However, if you're in a situation where you're not getting that information and you're also not getting the time that you think you should be getting, social workers or care managers from the healthcare team are a great place to go to ask for support in gathering more detailed information. And as a proxy, you are absolutely allowed to be asking for a care team meeting when things like that are not working out. So remember, you are the expert on your person, and they should be driving all of this through you. So if that requires meetings for advocacy or asking for more information, that's exactly what you should do. Of course, not every situation will work out the way we want it to, like we've said, and there are situations or wishes that people might have that just aren't possible. So we just want to be clear that can be very frustrating when this happens, but discussing some of these scenarios ahead of time can be helpful. So a few examples, your person's desire to be home for their treatment is not possible due to a need for round-the-clock care, which maybe isn't an option physically or financially. Perhaps the person says that they don't want strangers in their home, but you and the other folks who are part of their support team and loved ones can't be there as often as is needed. So having outside support will have to happen. Often somebody will want to die in their beloved home, in their space, but because they are unstable, it's unsafe for them to be moved. Alternatively, they might want to have care in the hospital right up until the end of their life, but it's not feasible due to space or coverage or discharge policies or all sorts of, bureaucracy and things like that. Um, or perhaps their wishes for aggressive life-sustaining measures are riskier for their health than the potential benefits. Perhaps they're not a good candidate for surgery, or pushing fluids and nutrition will be more painful than anything. And again, these are challenging scenarios, but it's important to know that these things do happen. And so you can talk about them in advance with the person you're supporting to see what they think, uh, what they would want you to do, which again is back to the core. If you have connected with the person you're a proxy for, asked lots of questions, discussed plans, identified family dynamics, talked through some of these scenarios, that is your foundation, that is your library. If there's any other performers in the room, I know Mickey is a fellow actor, or if there's authors or readers in the room, I sometimes think of this role being kind of similar to method acting or really deeply researching someone. It requires you to know enough about them that you can think like them and interpret for them in a way that you can't about just anyone in your life. And again, you are not expressing what you want, you're expressing what they want, what you know they want, based on all you know about them. And sometimes you are faced with the need to come up with what you feel is best based on what you know. And a situation comes up that you haven't even considered. And in these cases, utilizing the knowledge that your person imparted on you and the support of anybody in their care team that you've worked with, lean on your intuition and remember that you are the expert. Which again, finally wraps us up into taking care of yourself as a proxy. This role is so important, but it can be challenging. Self-care is not always bubble baths and chocolate. Sometimes it is talking through overwhelm with a friend, managing emotions that come up for you, maybe your own feelings about treatments or the medical system or your health and end of life even. So there could be a lot of issues for you that come up, and taking care of those for yourself and talking through them with someone is absolutely a form of self-care that not only allows you to be present for your person, but care for yourself really deeply in a rejuvenating way. Um, it can weigh heavily on someone to speak for another person. I mentioned it being like method acting or intense research, and kind of on the other side of that is a feeling of this is all consuming. And people who've been care providers and caregivers know that as well. It can weigh really heavily on you to feel like you have to speak for another person. So again, all of that prep work helps care for you. That's past you taking care of future you by having those conversations really thoroughly. And there's also, again, the things that maybe some people do say is healthcare, or excuse me, is self-care and maybe a little bit fluffy, but is very valuable and research shows is valuable. Includes, journaling, creating, if you're a crafty person, helping you process some of those thoughts that you're not ready to share with anyone, or maybe don't even realize you have, can be really helped through journaling or creating art. Engaging in your hobbies, moving your body, getting sunshine, laughing with friends. Again, research shows that these things give us the hormones we need to feel some joy and some comfort. And remember that even when we are managing heavy emotions and tasks, we can still and should experience joy. And so making sure that you make time for that is really important. And going back finally to something Osha said, I think right at the beginning, part of taking care of yourself as a proxy is recognizing if you've reached a point due to life change, your own needs, where you can't serve in that role anymore. And so just to reiterate, letting somebody know as soon as possible is self-care, and it's good for them and good for you, and nothing that you should feel bad about. I think next slide, I know we're right at the end, so the timing has worked. Here's a few resources in Osha if you want to jump back in to talk through any of these. These are a few resources that will help you navigate these conversations and get some of these answers going. And we will include these in a follow-up email, but you can also get to them by cnc.org/finishstrongtools. We'll have quite a bit of it, but we'll send more information. So that includes, again, our end-of-life decisions guide, which includes our dementia values and priorities tool, which is a dementia addendum for advanced directives. It comes in that guide. We also have our planning toolkit, our LGBTQ end-of-life planning toolkit that Osha worked on with Sage. We have the diagnosis decoder there, which has there's a little pop out of that, which is a tool we have on our website where you can identify what kind of doctor's appointment you're going to, and it'll help you navigate some questions that you might need to ask and give you some stuff you can take with you. Also, of course, your state advanced directive forms, which you can also get to from cnc.org/finishstrongtools. The death deck up there in the top right, the little picture, we love them. And there's tools like the death deck that have like fun, inspiring prompts that you can kind of casually share with people in your life, not just somebody you're a proxy for, that can help conversations get started. But of course, most importantly is you. Your presence as a proxy or as a person being proxied. I guess we haven't worked on, I don't know the terminology there, but you being present, taking care of yourself, asking questions and feeling empowered is the most important thing on this list. I think that might be the end of where we're at. Osha, Gathoe?
If I could add something at the very end, Megan, if you get a
Please,
chance.
Nikki.
Yeah, two things. One is fantastic. Thank you both for doing this workshop. And you'll see in the chat a ton of folks are super pleased with all the information. Just as a reminder for everyone, it's funny because one of the questions that came up, Megan, was like, what do you call the person for whom you are a proxy, right? And I'd love it if people would give us suggestions about that, because as you can tell, we don't have a very good word for it. We don't have a good naming culture for it. So please send them our way. And then also these valuable resources that we provide, particularly through these webinars, come from the donations. Our ability to do this come from the donation of individual supporters like yourself. And we would certainly appreciate you going to compassionatechoices.org and making a contribution today while you're accessing those Finish Strong tools that Megan mentioned and that are being listed in the chat right now. Thanks again, Megan. Thanks again, Osha, so much for all of the valuable information you provided. Any final thoughts before we go? Gathoe, Osha, Megan?
No, just thank you all so much for being here. Like we said, we will send a follow-up information. We'll see if there's any questions we missed that we can share with you. And thank you again so much for being here with us. We look forward to seeing you again for a different topic.
Absolutely. Thank you, everybody. Take care.